what do those statistics mean for the people in MaineCare who it's actually intended to serve and isn't?
So just at a human level, you understand if you don't have skin in the game, if you don't have, for example, a copay, you're going to be a little bit more likely to use healthcare. Whereas if you understand that you've got a $100 copay to go visit the emergency room or get a prescription or something. Yeah, exactly. Yes, copays are much larger for most working people. You're going to be a little bit more reluctant to go get every boo-boo looked at in the emergency room. Whereas if everything's free for you, why not go to urgent care? Why not go show up at the emergency room? Why not go get everything checked out? It's not like you've got a job.
In primary care, it's so hard to get into, right? We have an environment that has encouraged our docs to flee the state.
Of course.
Whether we're talking about the high taxes, the difficult system to negotiate, there's a million reasons that we are short on providers. And so, if you are trying to navigate that system, you're going to go to the ER or urgent care because you can't get into a provider for months.
And so what that leads to is an overutilization of healthcare. If you look, there's the Maine Health Data Organization it's a website basically that's supposed to provide transparent data on our healthcare system. Surprise, under the Mills administration, it's really slow to update and it's crappy and
shocker, it doesn't have MaineCare data.
Yeah, it's awful. But it has a little bit of MaineCare data, but not provider payment data. But one thing you can see is healthcare utilization rates, and you can see that the people who are people who have Medicaid are far more likely to use healthcare services than people who are commercially insured. That overutilization puts an additional strain on the healthcare system, which then leads to a lower quality of services. Yep. It's harder to schedule. The waiting lines are longer to get healthcare. The emergency rooms are crowded when you're trying to get in an actual healthcare emergency. I had a loved one who experienced, appendicitis, and we're trying to get to an emergency room in a genuine emergency, and it's crowded with a guy who has, there's a guy who has a bloody nose who thinks that he needs to be treated first because he's got the bloody nose. But this is, just kind of like a personal example that I had. Here. Yeah, this is a personal example that I had where this emergency room is just filled with people who, who am I to judge? Maybe they really had sudden onset, fatal bloody nose syndrome or something. But that's an example of where I experienced. I was like, this overutilization deteriorates the quality of healthcare for everybody.